Lots of people are curious about whitening teeth. It seems like everybody wants to know how to whiten their teeth. I think there's more important things to know about how to take care of your teeth, but if you want to know it, I'm going to tell you what you want to know. All right, so what is the best way to whiten your teeth? You're curious, let's talk about it. The number one rule of teeth whitening. A lot of people miss this, pay attention. Follow the instructions. Follow the instructions. Instructions are important, all right? So the whitening gel you use matters. How you deliver that whitening gel to your teeth matters. How long you have that whitening gel on your teeth matters. How frequently you whiten your teeth matters. How many days, how long of breaks you take between treatments, all of these things are important. You know, you've probably seen advertisements for whitening toothpastes. Those are not as effective as whitening gels. Whitening toothpastes are trying to scrape stains off the surface of your teeth. It doesn't whiten further down into the tooth the way whitening gel can. If you do use a whitening toothpaste, do not scrub hard. You can damage your teeth and cause gum recession over time. That looks bad, your tooth roots get exposed, and those, are brown and yellow. Not a great look. You always want to use a soft bristle toothbrush and brush gently with minimal pressure. If you use an automatic toothbrush, an electric toothbrush, just let it do the work for you. No pushing or scrubbing. All right, so let's talk about tooth whitening. Two types of gels can be used to whiten your teeth: carbamide peroxide and hydrogen peroxide. Carbamide peroxide degrades into hydrogen peroxide, so really, it's ultimately the same thing either way. There are two types of delivery methods for gels: whitening strips and whitening trays. Both of these can work effectively. It's kind of a personal preference. For me, I've never found any strips that I like very much. Comfort and fit have been an issue for me. But if you find some whitening strips you like and you use them appropriately, they can work great for plenty of patients. Personally, I prefer custom-made whitening trays. They're more comfortable and they are less expensive over the long run than repeatedly buying whitening strips. I like trays over strips because the gel spreads around into all of the nooks and crannies of the teeth. Strips generally don't conform to the teeth quite as well. If you're going to get trays, you do need someone to take impressions of your teeth and then make the trays to fit your teeth specifically. Ideally, this is a dentist who has checked your teeth to make sure whitening will work for you and that you don't have other more important problems with your teeth to address. Whitening doesn't work for everybody. There's a lot of reasons for that. But if you've been given a clean bill of health by a dentist and you would prefer to use some other service to make you custom whitening trays for your teeth because you don't want to get them from your dentist, that can probably work fine too, as long as your teeth have been shown to be healthy and able to be whitened. A small, perhaps obvious tip: before placing the trays or strips, you want to brush and floss your teeth to make sure that they are clean. Okay, so what are some side effects of whitening your teeth? Well, you can get tooth sensitivity. Your teeth get sensitive to cold. It can irritate your gums if you get the gel up on your gums. It's another reason I like custom whitening trays. It's easier to keep the gel on the teeth only. You really only need a small dab of gel on the inside of the tray. It doesn't take a lot. Whatever gel you're buying, make sure the syringes have fine tips on them so you can carefully only dispense small amounts of gel as needed, rather than squirting, big globs of gel into the tray. You're going to waste a lot of whitening material that way. If you get any gel on your gums, just slide the tray down, wipe your gums off with a piece of tissue paper. Really, just want to emphasize, more gel is not better when it comes to whitening. Less is more. It probably takes me a full week at least to use up a single syringe of gel. You're not going to go through it very quickly. I only put the gel on my front teeth. I don't really bother whitening my back teeth. Nobody sees those anyway. Your back teeth are extremely important for chewing, and you need to take care of them because they help protect your front teeth. I don't want to say back teeth don't matter. They're crazy important. But it doesn't matter if they are exactly the same shade of white as your front teeth, okay? Back teeth, super important. Just because you don't whiten them doesn't mean they don't matter. What concentration of gel should you use? I usually use a 22% carbamide peroxide gel. There are concentrations higher than that, and there's concentrations lower than that. Higher concentrations will tend to cause more sensitivity. Hydrogen peroxide will tend to cause more sensitivity than carbamide peroxide. Carbamide peroxide slowly releases hydrogen peroxide, so it's ultimately hydrogen peroxide doing the whitening either way, but it's just a little bit less likely to cause sensitivity, and you can use the gel for longer if you're using carbamide peroxide. How long should you have the trays in your mouth with the gel? That depends on the concentration and the type of gel you're using. Again, make sure you're following the instructions for the particular product you are using. It may be for as little as 30 minutes a day. Personally, I wear my carbamide peroxide gel trays while I'm sleeping, and that gel is active for about 4 hours. That might be too intense and cause sensitivity for some patients. You'll have to figure out what works for you. That might be too much for you to deal with. You can always, wear the trays during the day for less time. You can always go with a lower concentration gel. Now, usually it takes 1 to 2 weeks of consistent daily treatments to see significant improvements in whitening your teeth. For some people, it can take more time, for others, less time. If you already have cold sensitive teeth, then I strongly recommend that before you start trying to whiten your teeth, you need to use an anti-sensitivity toothpaste. These are toothpastes that contain either potassium nitrate or stannous fluoride. Even if the toothpaste says that it is fast acting, I recommend that you start using it consistently twice a day for at least 3 weeks before you start whitening your teeth. If you have a lot of sensitivity, you could even consider putting some of the anti-sensitivity toothpaste inside your whitening trays and wearing those for 30 minutes during the day. It's another reason why whitening trays can have an advantage over strips. Your dentist may also be able to provide you with an anti-sensitivity gel you could use in your trays before you would whiten. If you're still having sensitivity with your teeth while whitening, decrease the amount of time you're wearing the trays each day and decrease the frequency at which you are whitening. Skip a day or 2 or 3 until the sensitivity calms down, then you can try again. If you continue to have sensitivity after that adjustment, I would go for a lower concentration gel. Another tip when it comes to whitening your teeth, if you refrigerate your whitening gel, it tends to last longer. It can keep for up to about 2 years. Another question a lot of patients have, at what age is it safe to start whitening your teeth? There are varying opinions on this. From what I've read in the dental literature, I think it's reasonable to start whitening your teeth around age 14, so long as you have all of your permanent teeth in place. You typically are going to want to wait until all the teeth are in and in the final position that they're going to be in so that your trays will fit for the rest of your life. You don't want to have to keep remaking trays if your teeth aren't all the way in. A dentist obviously would be able to help you determine if this is the case for you. Also, if you're a younger patient, it's probably smart to use a lower concentration carbamide peroxide gel, something like a 14 or 16% concentration gel, to help avoid sensitivity. The nerves of our teeth are actually closer to the surface of the teeth when we're young, and that can make us more likely to have cold sensitivity with our teeth. Another common question when it comes to whitening teeth: do blue lights do anything to whiten your teeth better or faster? No, they don't. The research on this does not demonstrate that using a blue light on your teeth is any more effective or helpful than the appropriate use of a hydrogen peroxide or carbamide peroxide gel. So you don't need to waste your time or money with blue lights on your teeth. Doesn't do anything. Another important tip on tooth whitening: if you are having any cosmetic dental work done, make sure you whiten your teeth first. You want to make sure you're happy with the shade of your teeth. Then you want to wait at least 2 weeks, ideally closer to 3, before you have any new dental work done, particularly with the front teeth where you have been whitening. Why is it important to wait? Well, the hydrogen peroxide in whitening gels actually interferes with the bonding of white composite dental bonding or filling materials. They won't stick to the teeth as effectively due to interference from oxygen released by the peroxide. Also, you are going to get a slight drop-off in the shade of your teeth after you're done whitening. You want to try to match any new dental work to this sort of settled down shade, not the most intense shade you have when you're in the middle of whitening your teeth. Otherwise, you'd have to be whitening your teeth constantly to maintain the shade, right? Also, you cannot whiten fillings or crowns or veneers. The only way to change the shade of any of this dental work is to redo it. So you want to make sure you're happy with the color of any dental work before it is permanently placed. Even if you're having veneers placed to cover all of your front teeth, it can still be smart to whiten your teeth first. Why would that matter if you're getting veneers anyway? Well, veneers are thin, and the underlying color of the teeth can show through those veneers slightly. So the whiter and brighter the starting point, the easier it's going to be to modify and manipulate the color of your teeth with your new veneers. Also, this is really important to know. No one's teeth are pure white in color. That's not the goal, all right? We all have little hints and tinges of yellow, sometimes a little red or a little blue or gray. Our teeth have grades of other colors in them. So it's natural, normal, healthy, and attractive to have teeth that aren't a perfectly bright white color. You don't need to be panicking if your teeth aren't exactly white. Teeth are also more white toward the tip of the tooth and a little more yellowish toward the gum line. This has to do with how thick the enamel is lower down on the tooth and how thin it gets as you move up toward the gums. Enamel, that's the outer layer, that's the white layer of the tooth. Also important, some teeth are easier to whiten than others. Yellowish brown teeth generally a little easier to whiten than grayish blue teeth. Some patients have blotches on their teeth from something called fluorosis or hypo or hypermineralization on their teeth. Those are things that won't go away with whitening, but your dentist may be able to help you blend those areas in with the rest of your teeth, either with composite bonding material or with a treatment called Icon resin infiltration. Just kind of depends on the case what you're going to use. Another tip, some patients may whiten their teeth and not think that they're getting any kind of results from it. And that can be because, whitening is a slow process. So as your teeth gradually get whiter, you might not notice the slow change very much. So one way you can kind of prove this to yourself if you're worried about it, I don't know what you worry about, but if you're concerned, you could start by just whitening your upper teeth and compare after a few weeks to how your lower teeth look. The difference may be much more obvious that way, so you can feel a little better about, how the whitening treatment is working. As I mentioned, some patients are going to struggle with whitening. They have much deeper staining in their teeth and will require more significant whitening treatments under the supervision of a dentist to address it. Sometimes you have to whiten for many months to change the color of your teeth, but that should only be done under the direct supervision of a dentist. You shouldn't be running that experiment by yourself. You should talk to a dentist about your options. There are also lots of cosmetic issues with teeth that whitening cannot fix. Whitening does not change the shape of your teeth, the position of your teeth, the look or position of your gums. It doesn't fix cavities. Sometimes you do need additional help from your dentist to address cosmetic dental issues. Whitening your teeth is not a cure-all. If only. If only there was a mouthwash we could use and it just fixed our teeth and made them perfect. Not yet.